Ready.
Ready when you're ready. Okay. Good evening, everyone. Today is August 24th, 2026, 5 o'clock p.m. Welcome to the Board of Health meeting. We will begin, as always, by standing for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. And we're gonna go through some public announcements. The first is an update on the cyclopsoriasis. According to CDC, as of August 19th, the best buy dates for the recalled lettuce have passed, and products should no longer be available in stores or restaurants. So that gives everybody a lot more peace of mind buying those prepackaged lettuce bags. There was a recent recall on Outshine frozen fruit bars, which are those popsicles that are more natural ingredients, so keep away from those for the moment. Details have been posted on our Board of Health Facebook page. Thank you, Carol, for managing that. And we wanted to give a special thanks and shout out to Jacinia, our PN5 Shared Services Coordinator, who, along with Carol and Jason, distributed over 200 tickets at one of the Abington summer concerts, the Town Hall in Ames Knoll Park. Unfortunately, those tickets are out of stock. I believe we tried to get more, but they weren't available. But I'm really excited that that was able to be accomplished. So thank you, Carol. Thank you to Jason, who was unable to be here this evening. What a good thing.
Yep.
I wanted to also provide an update on our health agent position. We are on to a second round of applications, which closed today. Our committee will be meeting to review those candidates and send those recommendations to Mr. Maresco. Meanwhile, Dan Kelly has been addressing time-sensitive issues for us on a very part-time basis in our health department on Fridays. So very thankful to him as well for keeping Abington safe and addressing a lot of the complaints that have been coming through the door. And then that's it for me for announcements. Does anybody have anything else they would like to add in?
Do you want that one?
Did I skip one?
Yeah.
Yes, I would. I skipped one. Thank you, Carol. So Jacinia, our PN5 Shared Services Coordinator for the 5 towns, is planning to make regular rounds in each town, sitting in the health department offices, which is also a boon for us. So I think you said Thursday she was here this week.
And I believe she's coming also tomorrow, Tuesday.
Amazing. So on one of the days that Dan's not here, we will actually have a human being in our health department office. And more to come on what that will look like. I know that she's been answering the phone, assisting with a lot of the incoming questions. So thankful to have her support and services while we are stretched thin at the current time.
Great.
Good.
Perfect.
If no one else has anything else, we'll move on.
I did ask for shops to be put on, and somebody must not have gotten my
no,
email,
I
which is a
saw
constant
it.
problem. I did find a resource, and what it is it's put out by safeneedledisposal.org.
Mm-hmm.
And it lists the 351 towns in Commonwealth, and it tells you which ones will have resident restrictions. So these are the towns. So let me just go by the ones that I know. Hanover Fire Department, which is open 24 hours a day. They will take them and they don't have a resident registry. So you can go in there and not live in Hanover. Mm-hmm. And if Carol is doing the Facebook page, then maybe I'll just isolate the ones that
You don't have to be a resident
that you don't
for.
have to be a resident for. Some of them also provide shops. I might see whittle through, but it's a lot to print out and give. But I did want to say that Hanover Fire Department, and that's an easy one. And Stoughton is another town that does it, but that's the police department. So if you don't mind, Carol, I'll just isolate these ones that are just in a 5-mile area, and then we can let people know that this And I want to be careful as I say it, because I do know that when you put like a dot net or a dot something else with this, then you can get some people are very insidious with the way that they like to be malicious. safeneedledisposal.org.
safeneedledisposal.org.
Yes.
Thank you. I apologize. I did see your email, but I thought it said that it didn't need to go back on the agenda. So
Oh,
I must have
no.
misread it. My
That's okay.
apologies.
That's okay, I appreciate that.
Yeah.
But, you know, I just did want to get it on there because Dan's working really hard and everything like that, but if he's not there, like
Then
maybe
there's no one to
visiting
take
with the
them.
town manager or something, then it says a note on there that you can't just leave them. So I think that people want to have success.
No, for sure. It's definitely something that we need
And-
to keep on the burners because once we have a new health agent elected, we need them to make decisions and kind of
Absolutely.
bring us up to
And that's
snuff.
why I didn't want to do anything, because I didn't know, you know, if there was somebody hired or if there was a direction, you know, so I didn't want to interfere if that was,
No, please.
thanks.
Yes.
But for folks, if, you know, to open up their window.
I love it. Thank you.
Thank you.
You're very welcome.
All right, so we will continue on to discussion and action items. The first is approval of requests for additional garbage and recyclable containers pursuant to the rules and regulations of combined rubbish, garbage, and recyclable collections. And we do have a community member here who would like to request an additional trash barrel. If you would please come forward, join us, have a seat, and then I'll just ask you to state your full name and your address for our meeting minutes, please.
Stephen Maniscalco, 65 Captain Standish Drive.
Awesome, thank you so much.
Sure.
And I believe per your request, I received that you were looking for just an extra trash barrel, is that correct?
That's correct.
Awesome, can you tell us a little bit about why you're seeking an extra barrel?
Sure. Large family, constantly to the brim. I have an extra, oh no, I don't have an extra, I have a larger recycling bin that's always full as well. And yeah, I just need more space that I'm looking for. And just for household items, you know, we cook a lot at home, we don't go out to eat, and just space is tight. And trying to sneak over to my neighbor's barrels every week is difficult.
We have that in my neighborhood too.
So I'd rather just, you know, try to avoid that.
Sounds like you're doing your due diligence. You're filling up your recycling barrel as well. I appreciate that. I just wanted to make sure you're aware that textiles are no longer permitted in your trash. You're not happening to put any textiles in your garbage?
No.
Excellent.
nothing like that.
Thanks.
Sure.
There are bins for that. Just a reminder for everybody at the schools, and a percentage of all the clothing that goes to those goes back to the schools. So if anybody is doing a weed, I know our seasonal changes are about to happen. I just did it at my house. If your kids are outgrowing stuff, please try to remember to bring them to those ones. There's actually over right next to the library, and then also over by Beaverbrook. I don't know if there's one over at Woodsdale. I'll have to check.
I think they pulled them out. There's one at the police station too.
One at the police
Yeah,
station.
And we had a little problem with them in
I
July,
remember.
but that has been taken care of. I probably should have gone out to you guys and.
You were very
yeah.
they were receptive to your
Very
email.
receptive.
Yes.
Yes, yeah, so I just, you know, threw that out because you're on the subject.
Yeah. Well, I appreciate those two things. Thanks so much. Does anyone else on the board have any questions? I think making sure all the garbage is getting into the garbage cans to prevent rodents from, you know, circling around the area is important. I would be in favor of approving the barrel request.
Do we vote? I think we vote.
Yeah. All in favor?
Aye.
Aye. Any opposed? No. It's unanimous.
Yes.
Steve, could you just print your name so I know the spelling of your last name? Because
Yes, I was Lisa. Good luck. Good luck. Great. Awesome.
Forward thinking.
Thanks so much for coming out.
Thank you very much.
So there are two fees. There's one upfront fee for the extra barrel. I think it's $75. Chris said them when he was here at the last minute. I'm trying to remember what they were. And then there's an annual fee as well. I will have the town office get in touch with you about delivery and then collection of those fees.
I saw there was a bunch of them down the compost site,
The delivery came in?
the bins. Mm-hmm. Yeah.
Hot off the presses, hot
Yeah.
off the trucks.
Yeah.
Awesome.
Spanking new.
Awesome. You're free.
All right,
Thank
thank
you
you.
so much.
Thank you.
Thanks for
We
coming in.
did get a delivery and ordered 150 of them and 50 of the yellow covers so they could be interchanged.
Recycle.
Great.
Awesome. Good night.
Thank you.
Mr. Maresco, just for anyone, since we're mic'd up over here, just said that he did order a bunch of the yellow lids, which have been delivered, so that we've got garbage and recyclable barrels available. Okay. Next up on our agenda is a vote to approve meeting minutes from July 13th, 2026. I believe everybody has a copy of those. I would entertain a motion to approve.
I will make a motion to approve the minutes.
Thank you, Carol.
And I would second that motion.
Excellent. All in favor?
Aye.
Aye.
Aye. Any opposed? No, it's unanimous.
And I'm passing this to Katie
Me
to
for
sign.
signature.
For signature.
Thanks. Can I borrow your pen? Because I only brought red.
I'm blue, so
That's okay.
I don't think I have others.
Thanks. Can you pass them right back to Lisa?
Yes.
All right. And then lastly, on our discussion and action items is a discussion regarding the proposed regulation prohibiting the manufacture, sale, and distribution of kratom products, synthetically derived cannabinoids, and unregulated novel intoxicants. And we are going to do a discussion, a vote, and then talk about the next steps. I am going to pass the baton to Carol to go over this more in depth. Carol?
All right, thank you, Katie. Last week, on August 13th, in fact, the Commissioner of the Mass Department of Public Health, Robbie Goldstein, put out an emergency order, which the governor also signed off on, an order pursuant to Mass General Law. We have copies of the Mass General Law that explains the temporary placement of kratom on a Schedule 1 for FDA purposes. So this is very different than a ban. This is making the drug, puts it in a different class. And because of that, it is unlawful to possess or sell Schedule I controlled substances of any description. So it's kind of subsumed under those laws without some sort of registration, which I don't think is currently available for kratom and kratom-related products. Accordingly, as of the effective date of the order, which is August 28th, the possession, distribution, sale of kratom in Massachusetts is illegal, and any person in violation is subject to imprisonment or fine. The state also gives health agents and local boards of health enforcement capacity. And so we've got a couple of items around this to talk about. The state order is 1 year. It's great news, great news from as far as I could tell you, but it's temporary. In the State House, there are several bills that are in various points along the pathway through the State House that have very, very different interpretations of regulation, right? So some of it is very strict, some of it is very complicated. And so, you know, it might be a good idea. We were ready to go for a vote on our Abington kratom regulation last month, and our meeting, we missed our meeting for other reasons. And so I feel like we should go forward with that. Not because it would supersede the state, it doesn't, but because it will be there. If the state should change direction over the course of the year. And so what I think we should do is vote on the one we have, but I also want to show everybody our letter. We have a letter that is going to go out to all of the retailers in Abington who sell products like kratom and all of the kratom-related products. And so this is an explanation of the new Mass Public Health Order, and it really makes it clear what needs to be absolutely removed from the shelves, not sold, not possessed, and not distributed. And so this letter will go out to all of our Abington retailers tomorrow. We have a list of all of our establishments. And I'd like to thank Dan Kelly for putting this together for Whitman and sharing it with us here in Abington. I first would like to have everybody have a look at this letter. It's very legalese, Mass General Law, effective date. It has what you need to know if you were an enforcer or a retailer. And I think we should just rubber stamp it and get it out the door so that our retailers have this in their hands.
I just found a typo. I read it in email, sorry, and I didn't catch it, but I was just like perusing it again now. And it says, please contact the Abington Board of Health at Health. So we just have to correct that one little
Oh, okay.
mistypo and either put,
Oh, the Board of Health at Health.
yeah, put something, either the
Yeah, okay.
email or the phone
So
number.
I'll email this again tomorrow, Michael, but,
Sorry.
so,
No problem.
Better to have it perfect, though.
I meant to put like the phone number and the email address
Yeah.
in there. Okay, so, but other than that, the content is pretty standard. I think other towns are doing something similar for their retailers, just so that there's continuity between what the state
I like
order
that,
said
too.
and what the town is expecting from their realtors, from their retailers, and their realtors. Motion?
I agree. I would make a motion to approve the orders as well as to send out the retailer notice.
I have a question.
Yeah.
This is the first time looking at it, so.
Yep.
Can you just clarify for enforcement, it's totally up to us how we want to do, it doesn't have like an amount for fines or?
You'd have to read the entire thing that's in your packet, which is from the state.
So it's all defined in
this is-
there.
Yeah, the state has set the rules and how
I like that they
enforcement
took that out
happens.
of our hands, to
Yeah,
be honest with
So
you.
the 94C
So
to A.
we don't have any discretion while this order is still in place. We
It would be
follow this order.
universal.
The state supersedes us.
Oh, no, I just wasn't clear how that
Oh, so you're
enforcement
not,
was to take place.
okay.
It
Well,
leaves
it
it
would
kind of
be,
general. right?
Dan would get the notification in lieu of there being a full-time health agent, and then he would notify the required parties, is what I'm wagering would happen.
So this wouldn't be the police would?
I don't know. I don't know the breakdown.
I think they have given health agents and boards of health the authority, but I don't recall seeing anything about getting the police involved. So that's another reason why I like our regulation in place as well.
I was working with Randolph on this today, and what they have is a license revocation if they're caught. They're just, your license is gone.
Wow.
I think that's part of the,
It's probably, yeah.
of most of our
Yeah.
town-by-town regulations, but again, the state supersedes that. So I think our job now is to notify retailers and make sure it gets off the shelves, and that they understand.
Step one,
that-
phase
yeah.
one, right? And then Dan will be our advocate, and then all the more reason for us to have our own health agent
Yeah.
as soon as possible, and that's in the works, so it'll be good. I certainly won't be going and enforcing myself.
Yeah.
No.
You know.
That wouldn't be safe.
No, it would not be safe.
I mean, I think our retailers in town are pretty aware of what's happening. They were here for a public hearing, and, they know the issue is on the table and on many tables. And I think that's the problem. And by the state doing this, that gives cities and towns enough time to kind of coalesce around what it is we should be doing. And as more and more information comes in around Kratom itself, and the research gets distributed and disseminated, I think we'll know that that the commissioner did a good thing.
Right.
Yeah.
But no reason not to get the product off of the shelves now and implement some safety standards and get the ball rolling.
It's just days before it's,
Yep.
yeah.
So,
I'd go back to making the motion unless there's any further discussion.
about the letter?
Yeah. I'll make a motion to approve the letter with some minor edits to be made by just implementing the phone number and email for the Abington Board of Health Department and getting it to the retailers so that they have time to start taking action.
Right. I second that. Oh, no, I'll make that motion. No, wait.
I made the motion.
Okay, I'll second your motion.
Okay. All in favor?
Aye.
Aye. None opposed?
Okay, so I will fix that and get that to the appropriate parties to mail out or email out.
I'm happy to have some action on that finally. Feels
Yeah.
good.
And then the last thing is this is the final town council approved, and we worked on this for how many months?
A lot of months.
Yeah, a lot of months. And it is ready for a vote. And even though the state has done its thing just last week, I think having this on the books is not a bad thing, because it's really hard to predict what the world will look like in 1 year when you think about what it looked like 1 year ago. So, yeah, so I would love to have a vote on this tonight. So I will take a motion.
Also, it's did you, I don't know, think I got these ahead of time, so.
I didn't either.
Sorry. Take some time, look over
We
everything.
had questions about the
Town
fines and how
council.
the difference between.
Yeah, the town council was kind enough to explain, and
The non-criminal versus.
yeah, it's like, that's where the town has some discretion to, like, how it wants to pursue enforcement. But right now, we don't have to worry about that so much. It's just because of the state's ruling. And when we have a health agent, we will work together on making sure that is clear. And I think Abington in the past, our usual thing is to not go for criminal court, because that gets timely and expensive and not nice. You know, we're kind of more of the educate anybody who infringes upon regulations and work with them to rectify the situation. And I think we can go forward with that on.
So it
all
did
the things.
simplify it. Number 7, and just talks about the civil penalty. and-
Yeah.
Right.
Okay.
I was refreshing my memory too, Lisa.
I know, it seemed like we've been carrying this around longer than the other bag.
I agree, though. I think having our own in place, regardless of what happens down the line, will cover us and make sure that a product that is dangerous is not being sold in Abington.
Right, because we've also added in here this idea of unregulated novel intoxicants, other things that pop up that are chemical versions of chemicals and have a different chemical name and a different trade name, but are still equally dangerous. So I think that's all been clarified in here on what an intoxicant is.
Did you see the bottom of 8, Lisa? Sorry to cut you off at the end, Carol. Where it
Yeah.
just said, so if non-criminal disposition is elected, then the non-criminal fine for each such violation shall be $300. Each day of portion thereof shall constitute a separate offense. If more than one, each condition violated shall constitute a separate offense. So that would be like multiple products. Did they take the product off the shelf after they got asked to take the product off the shelf? They're gonna get fined again if the next day it's back on the shelves, which seems pretty reasonable. And any person who violates any provision of this regulation and/or any condition and permit or order issued by the Board of Health may be penalized by indictment or on complaint brought to the district court. Also seems reasonable. And then the other fine is for up to $1,000 as set forth in Massachusetts general
If you have a
law.
tobacco permit, you're part of a civil penalty for $1,000, so that seems to be the difference, whether. Okay.
I would imagine most of the retailers of Kratom, not all, but most, are also
be
tobacco
savvy.
retailers. So they're going to be well aware of those regulations as well, right?
Yeah, and Dan's such an amiable guy. He'll go out and,
Talk people through it.
exactly.
Yeah, I mean, look, I don't think anything's going to happen on August 29th. You know, I think it's going to, you know.
Be a process.
Yeah.
Would anybody like to make a motion?
I will. I'd make a motion that we vote on the regulation prohibiting the manufacturing, sale, and distribution of kratom products, synthetically derived cannabinoids, and unregulated novel intoxicants.
I'll second. All in favor?
I didn't know if I had to repeat all that if I seconded, but you jumped to be.
Sorry.
No, that's good.
I
Thank
didn't.
you.
I don't think we do. All in favor?
Aye.
I'm going to abstain.
Okay.
Is that
I think it still
majority?
passes. Yeah, 3-1. Yep.
Yeah, I just didn't have time to read it.
Okay.
I don't want to sit here and rush through reading it. I knew it would pass without me, so.
All right.
Yeah. Okay.
So we will sign that. And then that is the end of our discussion and action items. Thanks, everybody, for your hard work. That was a long time coming.
Yep. Oh, I thought you were saying thank you, we're finished.
No,
okay.
we still have more. No, just thank you for all the hard work on that. I really appreciated the open meeting, the open hearing. I just thought it was great.
emotional.
Yeah, it was.
Yeah.
To have so many people take time out of their busy schedules to come in and advocate for their beliefs, it was just really powerful. Very cool.
On both sides of the issue. It's
Yeah,
really,
for sure.
I think it was really a good
A
example.
well-attended meeting.
Yeah, and a good example
Yeah.
of good,
Politics, good town politics.
good town communication and politics, yeah.
And who was our counsel that helped us with this news draft?
Greg Corbo,
Corpo, yes.
2 Gs on Greg.
So the last thing on our agenda for this evening is our health agent report, which was submitted by Dan Kelly, who couldn't be present this evening. He submitted it as of August 21st. The first thing is a PN5 update. He advised that the voting committee, the representatives from each town, have approved to hire one person each for the positions of community health worker, public health nurse, and shared service inspector. So that is movement in the right direction. Right now, we don't have a public health nurse, community health worker, or shared service inspector. So that's exciting to get more people involved in the safety of the town. The vote was unanimous.
To be clear, that's the safety of 5 towns, because they are shared.
Oh, but that's what I was asking
Yeah.
you before.
No,
Yeah,
no,
clarify.
these are folks who are gonna be sitting in Brockton and be available as a shared services agreement.
Oh,
Yeah, they're not hiring for Abington.
but correct me if I'm wrong, we were gonna get our own part-time. Yes. So, yeah, come up. Yes, please.
We're gonna hear from Michael
Mr. Maresco.
Madam Chair, that is correct. So just clarification, so PN5 will have those people in place to help out, but it's really to help us,
Resources.
all
All
five
five
communities. The plan is, and we want to have our own nurse, under the regulation to do MAVEN on communicable diseases and things like that, you have to have an RN.
Right.
So I have a couple of leads that I will share tomorrow that we may be able to bring somebody in. So we bring someone in, say, for, 5, 10, between 5 and 10 hours, because what they have to do is they have to log into Maven, they get the data. If there's somebody, say, like with tuberculosis, that's one I'm familiar with.
Yep.
There's a regimen if someone has it, they have to take medication. One of the
Tracking.
things is the
Yep.
person, the nurse, the way it was explained to me, the nurse would actually physically have to go to the house a few times to make sure that they're taking the medicine in the right prescribed method of that. So we really need to have, and then, they do a report, they have to check in every day, so that's where the 5, and they do some outreach, what the nurse could do, and what I would love to see is maybe, 1 day a month doing blood pressure screening at the senior center or town hall, diabetic screening, they can go in the senior center or town hall, things like that.
Maybe seasonal vaccinations,
Seasonal-
especially for the elderly who are homebound, just as support. That would be amazing.
All of that, yeah, so I think that's all important. Working on also, once we get the health agent in place, then we need to have an administrative staff person that will be able to answer phones, schedule, take the calls on people that have issues with trash, or the barrels are broken, all of those things, so finally we'll have the Board of Health put back.
To write.
Do you mind if I ask a question, which I know is going to be important to us, to our note taker? Would you explain what Maven is, please?
So, to be honest, I should remember from COVID when I
It's a
met.
tracking
Massachusetts-
database.
It's in Massachusetts at the MA, and E is epidemiology reporting system. But I couldn't tell you what it is
I'm gonna look it
exactly.
up.
Yeah,
I can't
because
do it either.
It's a database.
and I just know that what happens in my world is I go out after these meetings and somebody will say, hey, Sue, what's Maven? And I know another Maven, which is Massachusetts Association Volunteer, and that's Maven too. Like we have with the NRA, it's the National Restaurant Association.
And the National Rifle Association.
Yes.
So this one is the.
So I hope you don't mind.
This is the one about epidemiology that the state has mandated every city and town keep track of infectious disease, as Michael said. Yeah.
Medical
So-
Alumni Volunteer Expert Network, that's not the right one.
You know,
So it
Ugh,
takes
but
care of
NASA
things
is the
like
one that comes up
tuberculosis,
first.
Like the measles, chicken pox, all of that.
So all of the
Chicken pox
infectious,
is probably not considered, I don't know.
I don't know.
I'm not a medical person.
no, neither am I, but that's why I thought it might be nice, like, for people that are listening.
Thank
This is
you.
for our
To
note
the
taker.
audience.
Oh, it's gonna drive me crazy until I find it.
All right, so we're in good shape in terms of people coming to support the health of Abington, make Abington healthy again.
We really are. And I want to say that Jody and Michelle in the assessor's office do a great job of screening the calls every day. Destiny is going to be here twice this week, so actually, we're going to have coverage in the Board of Health office actually 3 days this week. He's
Yeah,
here on a
yeah.
Friday, he's in and out, he does the inspections, follows up on the complaints. Destiny is going to be here Tuesday and I think Thursday, I think twice this week.
Yeah, this
Amazing.
is great. You know, we're getting help from our PN5 friends. Dan is from one of the shared services towns, and then now Jacinia is the official. She was interim, but now she's the official coordinator for our PN5.
And Dr. Montessori, it's been
You know, yeah.
fantastic being able to call him when he made sure he covered the Maven portion for us. It would notify us, and then he would have a nurse call if there was anything that needed to be followed up.
So far,
great
so good.
Cooperation by
And did you say the administration position is separate from all of that NP5 thing? That you're trying to
So it would
look
be our
at?
own person, our own town of
Part-time.
Abington employee, right?
Okay,
Probably like 32 hours a week.
nice.
That would be nice, yeah.
Yeah.
Well, it's important to have a face. When people come, they bring their Sharpies, they want to know what's
Yes.
People to answer the phone, scheduling meetings, scheduling inspections, all of that
Yes.
stuff. So-
General
Good.
questions.
Phone a friend just came in. It's Massachusetts Virtual Epidemiologic Network for
Okay.
Maven.
Thank you. I learned something.
Yeah, well,
former student.
I just like to answer questions because I know I'm going to get asked.
Yeah.
So I was being selfish.
So do you want to finish up
Yeah.
with Dan's?
Thank
so
you very much.
Thank you very much for those updates.
So, as Mr. Maresco just said, Dan Kelly continues to be in the office on Fridays. He wanted to give a shout out as well, especially to Jody for all of her assistance. He also wanted to just say thank you to everyone who has stopped in to say hello. He has enjoyed meeting a bunch of the Abington residents. He's such a nice dude. Just thankful for him and his support and help. And he had a couple of items that he wanted to just list off that he's been following up on the past couple of weeks or handling. He's received a bunch of trash calls ranging from loose trash blowing around or the need for new barrels. There have been calls regarding the compost site and the price to get rid of a bunch of items that he's been assisting with. There have been calls for abandoned and lived-in properties with overgrowth and other issues. Calls regarding household hazardous waste and how to dispose of it. He did a pre-operational inspection for a new restaurant at 800 Brockton Ave, so over across from the Walmart. He responded to questions regarding permitting of other things like barbershops, funeral directors, septic, and others. And he has helped with creating the notification letter that we actually just approved, which will be sent out to businesses for Kratom and the state mandated temporary regulation restricting the sale of the product. And he also has advised that he will help with a follow-up to make sure that the product has been removed from retail shelves. So, Dan, he's kicking butt for us. Thank you, Dan. And that was all that we had. Does anybody have anything they wanted to address? If not, I will accept a motion to adjourn the meeting.
I was second.
I'll make a motion to adjourn the meeting.
And Lisa, you will second.
Oh, thank you.
Is that okay? Yes,
I
yes.
wasn't listening.
That's okay, hon, you're doing something else.
You're
We all
writing and
understand that,
talking
and thank you
and
for
listening.
everything you do.
Yeah. All in favor?
Aye.
Any opposed? No. The vote is unanimous. Thank you, everybody. We are adjourned.